we normally have them get into senior citizen packages, primarily designed to look for age appropriate or age specific cancers that we like to screen for. So those packages are designed with that in mind. So for men, for instance, we check a PSA, which we don't normally check under the age of 40 or 50. So that would be something that they can look at. But for just about anybody, irrespective, I think just having an eye out on one's cholesterol. So the guidelines are very clear, like a USPS task force guidelines suggest, based on age, the frequency at which we want to check for blood sugars, for cholesterol, for pap smears for women, mammograms at what age to start, for colonoscopies and such. We have the luxury of tweaking it a little bit in India because of, for two reasons. A, it's not just a big, large trust or a fund or an organization like an insurance company that's trying to have an equitable distribution of the money, so all the people who are paying into it can get the care. Here are the patient funds for it. So I think it's very important to tailor it and customize it for each individual's risk as well as needs and mental well-being. I mean, many times we have patients who have this worry of throat cancer, even though they're not smokers, and you delve deeper, you find they're worried because their father might have had throat cancer, or an uncle or a neighbor would have just been completely fine and they had anaplastic thyroid cancer. So, how do you send a patient back without addressing that to their satisfaction? Not to enable them in that anxiety path, but enough to understand that and tell them, look, you don't worry, you don't have it. So I think to that extent, we can tweak our testings to make sure the patients are completely mentally satisfied and at ease. The other packages that we do try and offer is even for adolescents, for children, for pediatric age group, it's important to have it screened. I mean, at age 2 and age 19, at least one time we check the cholesterol, and we're constantly looking at 40 plus age group because that's when we anticipate problems to occur. But the real prevention starts at age 2. So I think age 2 is pretty much well covered because all parents, whether they look after themselves or not, take their children to the doctor. Yeah, so 19, I would think, is the best age to, inculcate good habits, good dietary, and almost all of my adolescent patients, they come with a relative who complains they don't eat well, they don't sleep well, they eat fast food, they're just not doing anything right. And one needs to understand the cultural milieu in the country is changing. And a lot of times there's not much of a dialogue between the child and the parents. So, I mean, a doctor needs to understand that and provide a lot more counseling than just diet and exercise to such patients. So it's important to actually target that audience so that you don't deal with the problem at 40. And that's why we find our non-communicable diseases upsetting and affecting individuals a lot earlier on than what we used to see when we first started practicing.